Coronavirus pandemic is putting a strain on our supplies, forcing many countries, states, and communities to compete with one another to survive. Now, here to talk about this is Ed Anderson with the McCombs School of Business at the University of Texas. Thank you so much for joining us.
Oh, thank you, Marcel. It's a pleasure to be with you.
Ed, early on, we saw a lot of panic buying, and Governor Abbott has relaxed a lot of regulations to get supplies to grocery stores. Have you seen this help grocery stores trying to restock food and cleaning supplies?
Yeah, no, the government's been really good in the state of Texas at facilitating what private companies have been doing. H-E-B in particular has, among others, done a lot of planning up front, and they've been able to take care of their customers pretty well. And they've gone to a lot of trouble to do that. And the state has gone to a lot of trouble to make sure that they can do the things that need to be done.
Yeah, and then we've also seen states and countries competing for medical supplies. Has there been an impact on which states get supplies first, such as either New York or Washington State getting supplies faster due to more cases of coronavirus?
Yeah, interestingly enough, we actually don't know as a country exactly where the test kits are. But as far as testing goes, the right places are being able to do this. So the most heavily tested states are Washington State and New York, as you would expect. California is a little bit behind, but it's not because they don't have enough test kits and they're not doing enough testing. They are having problems with actually taking those tests, processing them, and getting results. But the test cuts are getting there. So it seems like things are working pretty well.
Yeah, Ed, is there a reason why we can't really keep track of those testing kits?
Yeah, what happened is that early on, we tried to do everything federally through the CDC and the FDA, and we had problems with the fact that the initial tests that were done in the United States, our test kits just didn't work very well. And because we were so far behind, the federal government eventually just said, look, individual states, do what you can, develop your own tests. Academic centers, develop your own test. And just all of you try to do as much as quickly as you can. And that was the right thing to do. Of course, once you do that, it's hard to track what all these individual players are doing.
Gotcha.
But it's a better problem to have.
Right. And looking forward, how can companies and hospitals prevent victims to panic shopping in case numbers continue to rise? Or if we see another surge later on this year, how can we prevent that panic shopping?
Well, with respect to individuals and panic shopping at groceries, honestly, what's been done with respect to, for lack of a better word, rationing, saying that if you go into a grocery store and per visit, you're only going to get 1 dozen eggs. You're not going to get 5 or 6 dozen. That's actually helped because people go in, nobody's panic. They aren't allowed to panic buy as much. So there's stuff left on the shelves. And so the next time they go in, they realize that, there's going to be enough eggs next time. And that tends to calm things down. Now, with respect to firms, what they've got to do basically is just figure out, okay, how much do I really need? And then count what you've got on order, and don't order more. Gotcha. It's easy to say, harder to do, of course.
All right. Well, we are out of time. Ed Anderson, thank you so much for joining us. We appreciate it.
You're welcome. It was my pleasure, Marcel.